We Ohioans love our sports, and there's a big in-state rivalry in soccer between Columbus Crew and FC Cincinnati. Today, we welcome health commissioners from Cincinnati and Hamilton County, Grant Mussman and Greg Kesterman, to chat about the friendly rivalry and what they're focused on with their health departments. And later, who has a big sports memory from their childhood? From touchdowns on the playground to buzzer beaters to left-footed goals, we have some stories to tell. All that and more coming up on Health is Real. Come on in, stay a while. Andrew Stinson here alongside Angela Taw and Zach Watson. The name of the podcast is Health is Real from Franklin County Public Health, coming to you today, as we often do, from Memorial Hall, downtown Columbus. Angela, how are you doing today?
Great, Andrew. Happy to be here.
Wonderful. And Zach Watson, how about you?
Also very happy to be here. Thank you.
Great. Now, this is a really special episode. I want to be clear. You know, our podcast is called Health is Real. And that's a bit of a play, I know, on the Hell is Real rivalry that exists between Columbus and Cincinnati. And we have health commissioners here from Cincinnati and Hamilton County. We have Grant Mussman from Cincinnati and Greg Kesterman from Hamilton County. Welcome to the podcast.
Hey, thanks for having us.
Excited to be here.
Excellent.
Well, yes, we are very excited to have you. And listen, we have to live up to the spirit of the name of the podcast. And what is it, without a little light razzing involved?
Yeah.
So I wanted to pull up the record between the Columbus Crew and FC Cincinnati. And currently it stands at 8-4 in advantage of Columbus Crew. So I wanted to ask you both how that felt to you personally.
Realizing Cincinnati's only had a professional team for a few years.
Oh, okay.
We're feeling pretty good.
Yes. Well, that is a good thing. And listen, I have to give credit where credit is due. And I don't know how many of our audience members are sort of soccer historians, but I'm sure both of you know there was the infamous, what was it? Was it 20? Oh God, I don't know the year, but there was the infamous match when in the Open Cup where the Columbus Crew, longtime MLS team, our team here, lost to the upstart FC Cincinnati, a USL team, and it was a big deal for everyone involved. And then ever since then, there's just been this groundswell of this budding rivalry. I don't know how connected or dialed into soccer, but can you talk about sort of the effects that you all see on sort of the area, or what's it been like with the growth of that team down there for everything?
Well, it's been a lot of fun. I certainly don't follow soccer super closely, and being from Cincinnati, I've learned not to follow professional sports generally, but it's been a lot of fun. I've been to a bunch of games. They were at the University of Cincinnati Stadium for a while. That was a great atmosphere, and their new stadium is just beautiful. And I do follow them enough to have seen the bicycle kick goal from the other day. So.
It's also been fun to just see Cincinnati come together around the club and to make every single game exciting. We're also happy to host the World Cup. We have 4 games coming this summer to Cincinnati, Ohio, which is fantastic to be on the world scale here locally.
Yeah,
Absolutely. Yeah. But today, we're putting our differences aside in the name of public health. Isn't that right, Zach?
Yeah, I don't know why I was asked to confirm this, but yes, I'm so happy that you both are here. There's no animosity.
No animosity, of course. So, we're here in Franklin County. You guys in Hamilton County, what's it like being the commissioner? I'll start with you, Greg, of Hamilton County.
I've had the privilege to serve as health commissioner for 5 years, starting in 2020, which was a super challenging year, as you can imagine. But every single day is exciting. I love the team of people that I get to work with, and knowing that we're changing the health of so many residents in Hamilton County has just been incredible.
Excellent. And what about you, Grant?
Well, similar to Greg's, I started in 2022 as health commissioner for Cincinnati, and we're unique in that we have a healthcare delivery structure too. So we have a large federally qualified health center, and so a large component. I know Greg has some medical professionals also, but we serve about 40,000 people a year. So we've got a lot of reach And it's really neat being the health commissioner over a department that does both the public health component and has such a reach in the healthcare delivery part.
Gotcha. And I guess we're just kind of curious, we're here in Franklin County. What are some of the biggest issues that you would say are facing your community specifically? I'm sure there's a lot of crossover between Franklin County and Hamilton County in that regard. So I was just curious of what some of the big issues that you're facing right now are. We'll start with you, Greg.
So we certainly see all the same types of things, like cardiovascular disease is a problem in our community. And so to work on that, we're getting our residents active, and we're working with the 45 political subdivisions that we provide public health to make them aware of these types of community health issues. Also similar to Franklin County, we see substance use disorder as a major driver of loss of life for our residents, and we work every single day to try and make sure that folks can see another day and ultimately get into treatment. And so those are two that I'll start with. I'm sure Grant has additional ones to add.
Yeah, Greg's going to groan because he's heard me say this before, but this is my favorite topic. I don't love it, but it's my favorite talking point. Cincinnati has a 25-year life expectancy difference between different neighborhoods in our urban area, and that's due to preventable disease, which is a really big challenge. I think for a long time we've known that and not known how that compares nationally. And there was a group nationally that looked, and we're about, I can't remember if we're 14th or 12th worst out of the 500 largest urban areas in the nation in terms of life expectancy difference. So there's a lot of work to do on those sorts of things. And we know that the biggest drivers of it are cardiovascular disease, infant mortality, substance abuse, opioid overdose, cancer, and now that you've got me on the radio and in front of a microphone, I'm just and violence,
Yeah, a lot of big issues. Looking ahead, and how public health may change in the coming years. We never really know what to expect, right? We have to be fast on our feet. What's something that you look forward to in the coming years in your role in your health departments?
So I think we are hoping to continue to bring additional services to our community. In the last year, we just opened up a brand new clinic that provides tuberculosis and sexual health care. And so we're hoping to further expand those services. We used to have only 3 rooms. We now have 10 exam rooms, so we're able to see a greater number of patients. In addition, I think there's lots of greater opportunities to get in front of the communities that we serve and to help further make sure they're thinking about health when they are making planning decisions for their communities. For example, if you're allowing a new subdivision to go into the suburbs, are you thinking about walkability, and are you thinking about the things that would keep your residents healthy? And so I think we have a lot of opportunities in the next few years to continue to make sure health is number one when folks are planning.
I think there's a few things going on in Cincinnati or in our jurisdiction. One is many of our facilities are very old and rapidly aging, so we're looking at what our plan is for our facilities, and that's really led us to take a step back and say, what's our mission? How well are we delivering on it right now? And what are our facilities needs to do that? So I think the health department in the next 10 years or so may look very different physically than the way it looks now. The other thing I'm really excited about is the city's on a data modernization kick, and we have a long way to go. We actually just had an experience where the Mill Creek was in danger of flooding, and we had a large number of paper records down there. That's our current workflow for what those folks were doing in environmental health. And we had to move them out at the last minute just in case the Mill Creek flooded. It didn't, and our facility was fine, but better safe than sorry there. So with better data comes a better ability to understand what is the landscape in Cincinnati, where are the health challenges, and where can we partner with our community stakeholders. And there's so many in Cincinnati, so many interested parties in Cincinnati and Hamilton County doing a lot of great work in all the areas that we're challenged by that we just talked about.
Sure. I know we've looked forward a little bit into what we think is going to happen in the future. Maybe is there something that strikes you as the most different, the thing that's changed the most since you've come into your roles in public health?
I think right now we're looking at a changing federal funding system, and so that will have an impact here on the local level. So our teams are working to be as adaptable as possible to apply for future funding opportunities and to make sure we're successful. But I think that does have the ability to change what public health looks like in the coming years.
Yeah, I think just to add to that, with changes coming down likely in Ohio Medicaid, that's going to have a huge impact on our ability to deliver care. Right now, the uninsured rate amongst our patients is pushing up to 30%, which is a really, really high and really difficult to sustain uninsured rate. So those will be things that are challenges that may come in the future.
Unlike Dr. Mussman, who sees a primary care patient, we see predominantly tuberculosis patients and, as I mentioned, sexual health individuals seeking sexual health appointments. And our uninsured rate is closer to 50%. So a large portion of our clients don't have access to insurance, which is expensive to provide care.
There's, for those folks who do work in not only public health, but in sort of local government or government in general, some folks feel like it could be potentially a dour time, or certainly an uncertain time, if nothing else. Do either of you have thoughts about do either of you see anything sort of positive going on right now, or is there positive that you can take away from what's going on in your communities each day?
I'm happy to, I'll jump in first. So I think what's really interesting is that there is a broader discussion going on right now. What is public health? What is the role of it? And what are the public health conditions that people are interested in? And potentially, I think there's a lot of really positive, really interesting conversations that can come from that.
I think we also have a large portion of the community that is really thankful for our role during COVID-19 and beyond. And so we're seeing many community partners come out and support public health and public health initiatives and working louder and more active in their communities on some of our initiatives. So I'm excited to continue to see that community support for what we do every single day.
Yeah. And then my last question for you is, I always like to ask at the end of these interviews that are really, really good and valuable. You guys have both given a lot of good thoughts. Is there anything else that you want, not only our audience, our community, but your communities, if folks tune in from down in South, like, is there anything that you want people to know, whether it's stuff that you're doing or just like takeaways, anything important? Like, this is your space to sort of say anything that you want to say to folks if you want.
I know today we're talking about the rivalry between Cincinnati and Columbus and our soccer clubs, but from a public health perspective, we love sports. Having kids active and outside playing is so fantastic for long-term development and ensuring that those kids grow up healthy and strong. And so whether you like FC Cincinnati or the Columbus Crew, I'm super excited to see our kids participate in all sport activities and get healthy.
And sort of building on that, we talk about this rivalry and a little bit of light ribbing, but the great thing about it is that the Columbus fans are great when they come down, and it's a very productive rivalry, I'll say. You're not supposed to use friendly if it is a rivalry, and but there is a collaboration and a productivity there that I think is really interesting and kind of a spirit of moving forward. And I think that's there in public health too. We see it a lot just in the way that Hamilton County Public Health and the Cincinnati Health Department collaborate on a lot of things, and that goes throughout the state of Ohio.
Yeah, and to your point, when the Save the Crew movement was going on, FC Cincinnati fans were right there at the forefront with everyone who was trying to save the team, because understanding where we're from here in the Midwest, it's just, if it can happen to you, it can happen to anybody. And FC Cincinnati fans were very, very vocal in support of wanting the team to stay here and saying, no, we are not the replacement team. The state can have two soccer teams and we can make it work. So I think like you both sort of indicated, that spirit of collaboration and noticing that we're all sons, daughters, people of the Midwest is right. Always is key to the spirit.
And if the Crew left, we wouldn't have a rivalry.
Yeah, exactly.
That wouldn't be any fun at all.
Yeah, no, that wouldn't be fun at all.
Well, in the spirit of the fun rivalry we have a few questions, a few trivia facts between Franklin County and Hamilton County, and I'll just open these up and we'll see what we think. So, between Franklin County and Hamilton County, which has the higher population? Does anyone have thoughts?
Franklin County.
Franklin. Does anyone else disagree?
I don't know. I don't feel educated enough to.
Greg, you're absolutely right. It is Franklin County. The most recent population totals 1.3 million for Franklin County and 830,000 for Hamilton County. So, population-wise, point for Franklin.
We're
Is this how this is going down?
This is
what we're doing
competition. I've got another one.
Oh no!
Don't worry. We're not here to embarrass anyone. Geography. Which county, Franklin County or Hamilton County, is larger by area? And I'll say it's close. What do you think?
I answered the last one.
I'm gonna go with Hamilton County is a homer.
It is Hamilton County.
Yes.
That's absolutely right. 535 square miles, Hamilton County, and Franklin's 532 square miles.
Wow.
Very close in terms of area. And I have a few notes here from Redfin. They rank specifically Columbus and Cincinnati in terms of walkability and a bike score and a transit score. And so between just the cities, not the whole county, just the cities, which city is more walk-friendly? Is it Cincinnati or Columbus?
I honestly, I've been to Cincinnati more than a few. Cincinnati's definitely more walkable, I have to say.
Anyone else have thoughts?
Oh, I'm curious.
It is Cincinnati.
All right.
Cincinnati is correct.
Easy. I was like,
There
how
we
many
go.
times have I risked my life here in Columbus?
How about bike friendliness? Which city, Columbus or Cincinnati? Anyone have thoughts?
Cincinnati's put a lot of effort into adding bike lanes, but they're probably still.
I've never ridden a bike in Columbus. I have no idea.
I think Cincinnati too.
It's Columbus.
Oh,
Columbus has the higher bike score. Yes. Last, we have transit scores. Angela, do you have thoughts? No thoughts from
As
Angela.
health commissioner, I would encourage everyone to walk or ride a bike.
Yes, of course. Transit is Cincinnati.
All right.
Cincinnati's a higher score.
Does,
Good, great.
What does transit score mean? Like, is it just higher, less accidents, or what's that mean?
Well, it says that Columbus is more car dependent, and that Cincinnati has more regional connections and airport access.
Yep, that tracks.
So that's sort of the reasoning for the scores there.
Yeah. Uh-huh.
Now, I had a couple of questions about the rivalry, but Zach's already ripped through those in terms of who's won more matches and everything. I think, did you mention the first ever match between the two clubs?
I don't know if that USL, if the one I was referencing was the first, but that was quite early on. I think it might have been. I'm not sure.
Yeah, the first ever match Cincinnati won. Which
okay,
was,
that had to have been it. Okay, yeah.
Which was probably a surprise given that, Columbus was in the higher league at the time.
Yeah.
But then I would say probably the biggest game was that playoff game a couple of years ago.
That one
Oh
hurt.
yeah, that one was wild.
That was no fun. Yeah.
Yeah, no, that was wild. I could not believe that game and what happened. I didn't think we were even going to sniff. I was so worried because we just went on that end of season sort of tear. I'm like, it's gotta come collapse.
And we had an
now.
incredible season. It was the winningest season in MLS history or
Yeah,
something like
wow.
that. So
I'll say one more thing in favor of our guest here. I do really like that FC Cincinnati has, like you've got the legit like lion mascot thing going on.
Oh, yeah.
But I also do love the hokiness of the fact that like our team is named after our vibrant construction scene, which is always ongoing. It's just like, yes, but
is that where the name comes from? Really?
I think, having, again, I'm not like the biggest crew historian, but as it was done by a naming contest, if I know it correctly, it was done by a naming contest, and it was sort of pitched as sort of a sort of lifeline to the city's like blue collar roots, which featured like a lot of construction workers, and the old crew construction logo. Those were three actual people. Like they weren't just
Really?
like illustrated. Yeah, they were
I
three
like that
real people.
logo.
Yeah,
I wish they wouldn't have changed it. I like the old one
I
better.
love that logo. Yeah, that's my crew logo.
Well, we are so excited here. We had Greg Kesterman from Hamilton County and Grant Mussman from Cincinnati, both health commissioners here on the podcast. Thank you both so much for coming on.
Happy to have made the trip here to Columbus.
Hey guys, how was your weekend?
Good. How was yours?
Andrew, why are you so sunburned?
Because I was outside and it was a beautiful weekend. Weren't you outside?
Well, yeah, for sure, but I put sunscreen on.
I never believed in that stuff.
Sunscreen isn't like lizard people running the world, Andrew. It protects your skin from the harmful rays of the sun and helps prevent skin cancer.
Well, yeah, maybe I'll give it a shot because, man, this sucks.
Sunscreen. It's real and it helps for people, not lizard people.
What about our favorite sports moment? Do you have like a sports moment where you played something and you had a really good achievement?
Personal?
Yeah, personal? No. What about like professional? Like you have a favorite?
Yeah,
Like from your time-
I'm a professional athlete.
From your time as a professional
Right.
Soccer player, or
Yeah,
what was it that you did?
Naturally, that
That-
kind of soccer. Do I have a favorite team? No.
You've never like once had like a grade school kickball game that you were the hero of or
Do you
anything?
think I remember anything like that? Like from 10, anything before 10 years old is just like been
It might
shoved
be
out of my
a-
brain long ago.
It might be more of a guy thing because like I track with that. Like there was a moment when you scored the
What?
winning. Yeah, you remember it
you
when
remember
yeah.
you remember the buckets,
Yeah.
the scores, you remember
the
the
last
guy.
second touchdown as the recess bell is ringing. Yes.
You know how you probably like are emotionally well regulated.
Right.
We're not, and that space is filled with sports memories.
That's right.
Yeah.
I do have a vivid memory of playing Red Rover.
Oh, this is great.
And
Red Rover.
I don't know. That's it. I don't really.
Red
There wasn't
Rover,
like a
Red
moment.
Rover.
Send whoever right over it, and you're like all linked arms, and they
Yeah.
try and break through your arms. When in reality, it could potentially like rip your shoulder.
Yeah, I
out
think
the
they got
socket.
rid of doing that in elementary schools after a while, right?
No. I mean, it's just a playground game.
We
You
used to
can't
build
get
things
rid.
in this country.
Oh, you like chose to do this?
Yes,
Oh,
correct. This was
okay.
not. This was not like.
Like a gym class thing.
No, this was
Oh.
recess.
So what was the memory? What happened?
Nothing. I just remember playing it.
Put that on a Sports Center reel.
Dun-dun-dun.
Red Rover legend Angela Ta in the news this morning.
She participated.
She participated. And on to Michael Jordan.
Oh, that's funny. Hold on. What are your sports memories?
Like my personal sports memories?
Yeah, I guess
I
if,
mean-
if it's so odd that I don't have my own, why don't you
Well,
please
maybe
share yours?
it's not that odd. Maybe you're right. But for me and for others like me, there was a time I threw a touchdown pass like at
How
the
old
end.
were you? Paint the
don't-
picture, Andrew.
Okay,
please.
I'm going to say about 9 years old.
Okay.
Okay.
How tall?
Yeah.
Tall, about an average 9-year-old boy's height.
Well, I just
That's
didn't know
not a
because you're
height.
tall now.
I
So I didn't know
was
if you
never
were, like,
I was
always
never
tall.
that tall like as a kid. I
Really?
was always like average, like nothing.
So
And
nine
then-
Did
probably
you,
like
when did you like shoot up?
Probably high school.
so he
high
was
school
probably
rating.
in the lower fives, I'd say, anywhere like from 5 to 5'4", you would think, right? Like if he's
Are you
9.
telling me that I
Well,
am
you
the
asked about-
average? That I'm the height of an average 9-year-old boy?
Oh. Wait, you're only 5'4"?
I'm only
Stand up.
5'4". I have platform shoes on right now.
Okay, I don't know how that tall 9-year-olds are.
I don't either. That's why I said an average 9-year-old boy. Yeah, I don't know.
You come on, man. You could have thrown us
All
a
right,
number.
you know what? Back to
I
the
was
picture.
7 feet tall.
You were 7 foot tall as a
I've
9-year-old.
shrunk since then.
At the
Don't
at the
ask me
top
how.
of your
That's
game.
sad.
At the top of your game, you then shrunk down
I
due
did.
to is that Benjamin Button's disease,
Yes,
but with height.
but with
Oh,
height.
And
not
that's
height.
that is the clinical
Height.
that height or height.
no, it's height.
Height
isn't
the-
a word.
Wait, which one is you're confusing me? Height or height?
Height is the word. Height is not a thing.
I love that you think height this word. I thought I was the only one who said words wrong with like my full chest.
So you had Benjamin Button's disease,
Sure.
but with
Mhm.
height.
But with height.
Yeah, which is the clinical name for it. Benjamin Button's disease, but with height.
I thought you just
I
meant
thought height was the clinical. I
that's
think the doctors refer to this as height.
No, I mean not your condition.
It's
though.
how tall
you had a
you are.
condition. You shrunk. In the premise, you shrunk.
Honey,
And I'm
I
just trying
shrunk the height.
I'm just trying to yes and with you, and it's not going well. I'm going to quit this podcast soon enough. Don't you worry,
But,
I won't
I mean,
be here.
The memory is just, it's like, it's about time for recess to be over.
How hot was it?
It was
Was
hot.
the temp? It was hot
It was
out there.
hot.
Man,
Yeah.
it's a hot
It's one of those early days of school year, like late August sort of heats.
Oh,
Yeah.
so this was the
You're on-
beginning of the school year. So this
Yes.
really set the tone for you for this grade.
It most certainly did.
Okay.
It was on like a black top too.
Oh, you weren't even
Yeah.
on like a grass field. You were playing football on the blacktop. Was it
No.
a regulation-sized NFL blacktop field?
the 9-year-olds, we didn't measure. I don't think we had the time or infrastructure to measure. So we just kind of went with it. I think that's kind of how you normally do.
So you got to be quarterback. Was this a regular occurrence?
No,
Oh,
no. See,
wow.
that's what kind of makes it special is because I was not the most athletic person. I know it's very difficult to believe,
Well,
but
because of
it's
how
true.
tall you are.
Well, I
Yeah.
was 7 feet tall. I had the height, as they say.
You were an athletic
And-
powerhouse.
And so it's the end of recess. We're down a touchdown.
Whoa.
It's-
He knows the score.
It's the last play. It was a bomb too. I heaved one deep down the field, down the blacktop.
Hail Mary.
Hail Mary, as they
Wow.
say. Yeah. And as the whistle was blowing for us to have to go back to school, my wide receiver got in the end zone. Everyone was putting their hands up. It was a joyous moment. You remember things like that.
You do.
You remember.
You really do. You
Zach,
do.
do you have a similar kind of story?
I've got like 5 that I could tell you.
give me one.
That's really hard. I think I'm going to tell you all 5.
Well,
so-
tell us your height.
How,
yeah, my
how
height.
height were you?
Listen. I loved the Lin-Manuel Miranda movie In the Heights.
That's a tongue twister.
That's a tongue twister for
In
sure.
the heights.
In the Heights. So anyway, there's a couple I have in my memory. There was one I hit a corner 3 with at the buzzer for halftime, and it looked dope.
What did you just say?
I hit it. So I played a basketball game
Okay,
where
thank you.
where the ball came to me and the corner clock was running down. I just got the release off right as
What's
the butter.
the corner clock? You're
No.
saying a lot of things I don't know.
So the time on the
Basketballs
scoreboard.
are round,
Yeah, got that. Orange too,
typically, but not always.
with black stripes.
This
Sometimes.
segment is melting down faster than I can keep track
No,
of.
you just gotta explain to me like
Okay.
I don't know anything about sports because I don't.
Okay. So, in the second quarter, which is right before halftime of the basketball game I was playing, the clock.
2 of 4.
Yes, 2
Okay.
of 4.
Got it.
The clock was running down to about, it probably was only about 2 to 3 seconds left.
To halftime or the shot
To
clock was
halftime.
running down?
Halftime,
Okay.
not shot clock. In youth sports, there usually is not a shot clock.
Oh. wow.
So clock was running down. I got the ball kicked to me, passed to me rather, in the corner, and I put up a corner 3 as a person ran by me with their hand in my face, and I ran the opposite way, trying to get past his hand to look and see if it was going in. So I was already sort of running towards the direction of the locker room to see if it went in, and it just swished right through, and I just led my team to the locker room.
You just kept running.
Yeah, just kept running.
That's
It was
sweet.
it was dope.
Still
wa-
corner 3. I'm lost.
So
it's the direction of where you are on the court, in the corner.
But
Yeah,
I thought
so
I
you've got
thought
the arc.
The arc, yeah.
Yes. So
There's no corner in an arc.
There is a rectangle around the whole court, though.
yes. So if
Oh my God. Okay,
Yeah.
so
Yeah,
so
so
the
in the
whole
arc, I was
rectangle
right,
you were
yeah.
over. So the arc is here. You're
Yeah.
here. This is terrible radio, but okay.
Yeah.
And it's a 3.
Yes,
See
behind
now,
the arc,
thank
yep.
you. That's all I needed.
No, and I appreciate you asking and making me clarify because that understanding is
And
important.
how old were you for this?
I was as a freshman.
What was the temperature in the
in
space you were in?
Indoors,
the arena.
right?
It was indoors. I
Yeah.
would say it was about a cool 68.
Were you sweating?
I assume.
Oh
you will.
yeah, I was playing.
Well, I don't know. I mean, sometimes people
Listen,
just are like so
I gave it all out. I gave it
athletically
my all out there.
inclined, so they're just like, I could do all this, and they're like, I'm not even breaking a sweat.
Look, I was all about the fundamentals. I was playing hard out there.
Okay.
There was one time
Street ball.
There was another moment where in a kickball game, a
Okay.
person, I had kicked it. A person was charging at me to throw the ball, and I did like, I can't explain it, but I did like a breakdance move on accident and
What?
invaded. Like they were literally at point blank range about to throw the ball at me
Uh-huh.
to
Dodged
get
it.
me out, and I dodged it like by doing like a spin.
That's
move.
awesome.
And that was rad. Someone came up to me afterwards and was like, that was incredible. That was
See?
a sophomore year.
And you remember that all these years later.
Uh-huh.
So what's funny about that is you initially said a breakdancing move, and all I could think of is when people are on their head and they're just spinning.
Oh, yeah.
He stopped.
Oh, man, yeah.
Got on his head, spun around,
Just wildly confused the thrower.
just stood
why
there
they
with the
didn't
ball,
go.
watching you like, what's going on?
This man is popping and locking, and we're in a kickball game. What's happening?
Why is he doing the robot right now?
Yeah. Angela, I was gonna ask you what your sports glory moment was.
I do actually remember one now that we've been talking.
Hey, there we go.
Okay, so here's the thing though. It was not when I was young, so that's like kind
That's
of
okay.
weird. No.
It's okay.
Okay, so just to preface, I played a lot of sports when I was young. I was never very like athletically inclined, but I was always happy to participate. I had a lot of energy as a child, so I was always running around. And so all through my life, it was very like someone's like, "Hey, you want to try this?" And it's like, "Sure, why not?" Like, yeah. And so in college, there was a friend of mine who had an indoor rec league, and he was like, "Hey, we need a girl on the team. Do you want to play?" And I was like, "Yeah, sure, whatever." And I loved in soccer because I had watched a couple games with him. I loved in soccer when like there was someone who was like really just going for it, and then all of a sudden there was someone who just like came out of the corner and was like, "Bing," and it's like the whole thing's ruined.
Yeah.
I loved that. I was like, let me be that person.
The defender.
Yes,
Yeah.
because I'm an antagonist.
You wanted
I'm a
to
younger.
ruin.
I'm
Yeah.
a younger sibling, and I know I'm like, yes.
I'm here
let
for
me
all
just
of this.
like,
Yeah.
So anyway, so I was like, let me be a defender because I just want to like thwart everyone's plans.
There you
That
go.
sounds amazing. He's like, you're far too small to be a defender. And I said, all right. So he had me on, I don't even know what the positions are. There, I was the side, the one on the
Like a wing.
like a striker, wing, whatever whatever it is. Anyway, so first game had literally had bought these cleats that I'm wearing like maybe hours before, and I had the ball and I was like, what do I do with this? And so I was like kicking it around. I probably looked like an idiot at this point, but then I got a goal, and I was so confused because I didn't think that happened. And he was like, "Are you left-footed?" And I was like, "No, why? I kicked with my right foot." He's like, "No, you kicked with your left foot, but you got it. So good job."
Wow.
It was so crazy.
Off
so
the left foot, and you're right-handed, right?
correct.
That's in that.
I don't know how I did that. Why did I do
Opposite
that?
foot.
I play soccer. I played soccer too, and I tried to work on like left-footed shots.
No.
And I couldn't do it.
No, no left foot. Like we had practiced a little bit, but I was always trying to make goals with my right foot,
Yeah,
and it was a
So in the moment, you
it
don't
was
remember.
just a mistake.
Yeah.
yeah.
But that's
I was just like,
incredible.
I don't know. I just got to get it in, and like
That's incredible.
probably like
though.
floundered both of my feet.
But
and
you
the
got
left
it
one
past the
actually hit it.
goalie. So
Yeah.
Yeah, with your left foot. That's like I need you to understand that's like very difficult. If
Yeah,
that's
see,
not
he
your
did the
expert-
same thing, and I was like, I just kicked it. I don't know.
that was your first game too?
Yeah, and then I never played after that.
Oh my god!
Went out on top.
Yeah, exactly.
There you go.
I just love. It's like when a savant is just like I don't know.
I've
Like,
mastered this. I don't need to do it anymore.
No.
Yeah, no,
none
but
of
that was crazy. That's a great story.
It is.
Is there a sport that you watch, or not? You maybe don't watch, but a sport you're like, I'd love to try that one day, but probably will never get the opportunity to, because we're adults now, and it's probably not wise to get into physical activity that we don't know how to do.
For sure.
No. I mean, I watch sports. I like to watch sports, but I don't have like a burning desire to like pick up.
Not even like some ambiguous sport.
Like what? Like, give me an example.
I don't know. I'm thinking
Like
like
badminton?
polo.
I don't know what that is, so no.
Isn't that on the horses? Yeah.
Yes, you're
Well,
correct.
I'm
It's like
missing a key
croquet and
ingredient of that,
horse.
which is horse.
That's what I'm saying though. But wouldn't you want to play if you could play? If the opportunity arose?
That would be one of the least likely ones because first I
No.
would have to learn how to ride the horse.
Oh, you've never ridden a horse.
And then like playing a sport while riding the horse.
I thought you were from Marysville.
Do you think everyone from Marysville rides horses?
Well, yeah, don't you have like a ride your horse to school day or something like that?
Oh my God.
We had a drive your tractor to work, to school day in Grove City.
Okay.
I don't know.
Well, you know, Zach is having a moment.
I just,
No.
In Angela's mind, I just want to cover something really quick. In Angela's mind, they had bring your tractor to school day.
Yeah.
She thinks
That I'm from the 1800s.
yes, precisely.
No,
that
no,
it
no,
is
no,
the
no.
Wild West.
No.
I'm not
I'm
that
just
much older
saying
than you.
Even like, okay, if Grove City, which is like a suburb, used to be rural sort of area, still has drive your tractor to school day, what is the more country alternative for a more rural school?
Walk to school day?
Take your
Horses.
Take your stagecoach to school day.
No.
Come with your ma. Come with your pa.
I stand by my question. I don't think it
Well,
was that
I
unreasonable.
love that question, and we'll never forget it.
Yeah, I don't want to learn how to ride a horse for the purpose of playing polo.
Okay. Would you learn how to ride a horse for a different purpose?
No.
Okay.
Yeah, no real desire for the horse riding.
All right.
Maybe,
Horses are beautiful but
They are.
deranged creatures.
I
Yeah,
agree.
that's the best part.
Do you ride horses?
No, I had a friend in high school who had horses. So, but when I went over to her house, we would ride. But
The thing about horses is, picture if you were doing an activity with your friends and they introduced you to this person that you hadn't known before, but you were counting on them for a key part of the trip. Like maybe they're driving or whatever. Like, hey, we're riding with
Hey.
Ronnie, but just so you know, Ronnie's a little skittish and kind of crazy.
yes,
And that's horses.
yes. No, I love that. They're so chaotic. And yeah, no. See, here's the thing. If my parents would have found a house literally 4 miles down the road and we would have lived on a farm, I would have 100% been a horse girl.
To answer your original question, I would do, I love volleyball.
Oh,
I love beach
okay.
volleyball.
I was not expecting that.
I played a lot of sand volleyball at Ohio State when I was in college there, like just at not like organized, just
Yeah.
with friends because they had those the sand pits there.
Yeah.
To end the sports segment, can we pretend like we're putting our hands in and go on 3, 1, 2, 3, sports?
Should we pretend or actually do it?
Do you want to do it in real life?
Let's do it.
Yay, bad radio.
So on 3, we do 1, 2, 3.
1, 2, 3 sports.
Just that.
Okay.
All right, here.
1, 2, 3 sports.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Let us know your thoughts at fcph@franklincountyohio.gov, and be sure to follow us on your favorite social media platforms. And did you know that we offer vaccine clinics and education throughout Franklin County for both children and adults? Talk to a public health nurse to ask questions or schedule your vaccine appointment by calling us at 614-525-3719 or email shots@franklincountyohio.gov.